All right, thank you very much, and thanks for coming. And obviously each of you is motivated to be a part of this session for some reason. So I hope that it meets your expectations, and we do have Q&A time, but if you feel if you're impulsive and want to ask a question in the middle of the talk, I don't mind being interrupted and stop and answering a question, so feel free. This, of course, is titled Succession Planning, the Founder's Dilemma. Before I go further, I would like to say that I have no conflicts of interest and no disclosures. I wish I did, but I don't, and because I'm not getting rich off any of this, so it'd be nice, but that's all right. I don't have any. And I also want to just pause for a moment and just think, I'm amazed at this whole conference, and I love hearing the testimonies. Like Daniel's song yesterday, who in their right mind would give up an incredibly prestigious scholarship to study at Oxford to possibly go to Lawndale? He didn't even have that lined up yet, but he got it and he went there and it changed his life, And then like Robert Record, who I've known for 20 or 25 years, to sharing his life story a bit there. And I had no clue about a lot of that stuff. And everybody has a journey that can teach each of us something. And his growing up as a kid in very rural Louisiana stands in stark contrast to my way of growing up, which I'm going to share a little bit of that today. I used to be the CEO, so that's spoiler alert, right? If you want to see the movie and don't want to know the ending, then don't hear that. So unhear that. But I was the founder. Now, I have a prop here. You can see it's a sock. I was going to say it's a pair of socks. I got the other one on. It says, I call the shots. Okay? Maybe I should change the words to, I used to call the shots. So, yeah, used to. So here we are, the founder's dilemma. Now, I think it's nice to introduce myself a little bit. I believe an audience always likes to hear about the person who's speaking to them, but the biggest sort of pause I have about trying to do that is that I realize that there's really only one actor on this stage, and the spotlight is on him, and that's Jesus, and it's not me. So I don't want the attention to be so much on me, but on him. However, I do know that audiences like to know who is talking to them. So I'll take a few minutes and do about that. Then I'm going to come back to that in a minute. So I am Bill Warren. I'm from Atlanta. I was born in Atlanta, and I grew up in Atlanta. I've spent almost my entire life there except for my college years. My wife Lynn is here. So she came on this trip with me and enjoyed the conference. And Brianna Lathrop is here, who works with me at the Good Samaritan Health Center and is now our Chief Executive Officer. So having both of them here is a real big blessing. Lynn and I have 3 grown children and 3 wonderful in-law children. We have 11 grandchildren, and 2 of them are in heaven. So we can talk about that more later if you'd like to know. But part of the point of sharing that is that nobody gets out of this life without some kind of trauma and suffering. And that has probably been our biggest source of trauma and suffering in our married lives. But nevertheless, the 9 little grandchildren we have left, we love them dearly. And I wouldn't say this if any of the kids are here in the room with me, but only 2 out of the 11 are girls. So you kind of know where I stand with that. And one of them has blonde hair and one of them has red hair. And we never had a redhead person in our family before, so where'd this child come from? But we love them. We love them all. We all love all 9 of them all. But it's hard not to, for me anyway. But I wouldn't say that the kids were sitting here. But so Lynn and I love traveling. We enjoy, hanging with our family and having vacations together and those kind of things. I enjoy hunting and fishing. I enjoy running and doing triathloning. Although I've gotten a little bit older now and it's my body is not cooperating like it used to be, so I don't get to do some of those things so much anymore, but still, we enjoy those kind of things. And we enjoy spending time in the country. So that's a little bit about me. Now, I'm going to propose a question to you. would you rather align the trajectory of your career and the conclusion of your career with either Bjorn Borg or Tiger Woods? So you're going to reflect upon that, and then we're going to come back to that at the end. Bjorn Borg was one of the greatest tennis players of all time, and Tiger Woods was one of the greatest golfers of all time. People from Ohio would say he isn't because Jack Nicklaus is. People from Georgia would say he isn't because they would say Bobby Jones is. But nevertheless, on many people's lists, he'd come up as the #1 greatest golfer of all time. Bjorn Borg, probably a little less known to you all because he is from Sweden, but nevertheless, he had an outstanding career. He won 11 tennis majors, including 5 Wimbledons. And Tiger Woods won 15 majors. And of course, Augusta right now is alive with the Masters. That's one of the ones he won more than once. Both of them were ranked #1 in the world at some point in their careers. And y'all are familiar with Stephen Covey. And he, in one of his 7 habits of highly effective people, he says, begin with the end in mind, meaning that one should have a clear vision of a desired destination before starting, assuring that daily actions and short-term goals align with long-term objectives. In Proverbs, Solomon writes something similar. In chapter 6, verses 6 through 8, there the words of God are inspired and say, "Go to the ant, O sluggard, observe her ways and be wise, which having no chief, officer, or ruler, prepares her food in the summer and gathers her provisions in the harvest." You might think of this as being forward-thinking preparation. I believe that the mindset of any successful organization needs to be led by people with forward-thinking preparation. And however, I cannot say in 1995, at the age of 41, when I began the journey of providing health care for the poor, marginalized, and underserved, that I was considering a CEO transition, and nor was I considering what the CEO transition entailed. I didn't understand what Paul said in 2 Timothy 4:7. Because you think about the CEO transition, it's sort of like the end of things in a way, right? And what Paul is talking about here is sort of the end of things. And I didn't understand that. When he says about a life well lived in Christ, he says, "I have fought the good fight, I have finished the course, I have kept the faith." So I understood what it meant to try to achieve a goal. So you set out to achieve a goal and you start lining up the things you need to do to make that goal happen. And all of you here, some of you may be founders, some of you may be in positions of leading organizations. And so I understood what it meant to set a goal and then begin to do the things, the steps needed to achieve that goal. And I think the one that will resonate with you all the most is starting your own organization. Well, there wasn't a book out there for me to read on how to start a health center serving the poor. I was a little bit clueless about that, but I knew I had to get started somehow, in some way. So my first time of starting one was at a tiny little place called the Techwood Baptist Center, sort of an outpost church in the middle of a housing project in the city of Atlanta. So that was part of my homework. I also did some homework by visiting other health centers that did this kind of thing, such as the Church Health Center in Memphis. And actually that was founded by Scott Morris, who I went to high school with. So how about that? And then I did things like volunteer at 3 other clinics serving the poor, one in Gainesville, Georgia called Good News at Noon, one in Atlanta called Mercy Care, and another one in Atlanta at Grant Park Family Health in Grant Park, which is part of the city of Atlanta. So I was doing my homework that way, and also doing my homework by just living it. Being at the Techwood Baptist Center and seeing what it was like to try to operate and run a health center, having sort of one employee, although she didn't really report to me. I didn't pay her salary. But nevertheless, she was a godsend to have someone work with me. And and she actually was there before I was. So that was a nice thing because I didn't know what I was doing, and she did. So I leaned on her shoulders a little bit, and she was half my age. She was 20-something and I was 41. So it was nice to have a younger person who kind of carried me along. But before we go any further, this is where I was going to just take a pause for a minute and just share a little bit more about my own life journey, because it's in my life journey, of course, that my worldview was formed as a Christian young man. Just as you all have a journey and your worldview was formed, mine was too. And like Robert was sharing this morning, growing up in rural Louisiana in a town of 2,000 people, like I said, I grew up in metropolitan Atlanta, a city of several million. I did not go to public school. I went to private school. Yes, I went to snobby private school. I didn't know that at the time. I didn't know anything different. I found out about how different I was when I went to college. I went to a public university and met kids there who were real different than me. I met kids whose fathers were farmers, whose fathers earned hourly wages and worked in gas stations, whose fathers were not professionals. And yet at my school, where I grew up, either everybody's father was a professional or everybody's father led their own business or owned their own business. So their fathers or mothers, in most of the case fathers, were leaders and could afford to send their kids to private school. So that's kind of the way I grew up. And I grew up in a Christian family, although I will say that I didn't really understand what it meant to have a personal relationship with Jesus till I got to college. I also didn't understand what it meant to sort of acknowledge that something separated me from God, which was sin, and acknowledge the fact that Jesus was my Savior through faith and through grace and through Christ working in my life. But I learned about that in college, and I sort of, when you know how it is, you come to a point in your life where you sort of reach a crisis moment and you start wrestling with things. And in college, I started wrestling with faith and really became kind of a bit of an agnostic for a while. I said, I just don't understand this stuff. It doesn't make sense to me. But one guy came to my door one day and knocked on my door, and we were talking, and he said, have you ever read the Bible? I said, I sure have, and I think that took him aback. What is your favorite Bible book? And I said, Job. And I think that probably took him back even more. And he said, why? You think, well, I don't think he didn't ask me why Job, but I think the reason I was for Job because it was a really interesting story, right? But nevertheless, he said, well, if you ever decide to read the Bible again, begin with the book of John. I said, okay. So I tucked that away. And many months later, I started reading the book of John, and it was a little bit like a C.S. Lewis journey, because you remember in his Surprised by Joy, you've read the book, okay? So it's like going on a car ride. He was talking about that, and he didn't believe when he went out and he came back and he was a believer kind of thing. Well, for me, it was like reading the book of John, starting out not really being a believer. By the time I finished, I was, but I don't remember like a moment when it really happened, but it was sort of a slow percolating thing through my brain. So I started crafting, like a biblical worldview, and having grown up in a family with means, and when I say means, considerable means. I also understood the Bible verse that to whom much is given, much is required. And you can, of course, say given can be many things. It could be intelligence, it could be opportunity, it could be financial, it could be family support. Means many things. But I feel like I had sort of like advantages that way in being all of them. So between my third and fourth years in medical school, I had the opportunity with the Christian Medical Dental Association to attend a mission trip in the Dominican Republic. Some of y'all have probably done those kinds of things. We were gone for about 2 weeks, and we had clinics where we would treat kids, treat adults, do dentistry. We had a mobile surgical van, and I learned an awful lot about missions by doing that. I couldn't participate in surgery because I was only a third-year medical student, but I did participate in both the pediatric clinic, the adult clinic, and the dental clinic. I learned how to do injections to numb teeth and then to help and assist the dentist. I can't do them now, but they taught me how to do that so they could line up the patients, get them quickly numbed up, so they were showing me how to do it, so I did it. Now, nowadays you can't do that. Malpractice wouldn't allow it, but still, when I went to had that occasion to travel there to the Dominican Republic, I sort of came back a changed person, seeing what poverty was like in another part of the world, not just what it was like in Atlanta, Georgia. And Lynn met me. We weren't married yet, but we were seeing each other and had been for a year by that time. And she met me in the airport and took me home. And she said I came back a changed person. I didn't realize how changed I was, but obviously she did. And so that started giving me the motivation for wanting to do some kind of medical ministry. So fast forward a little bit, I finished medical school, finished my pediatric training, and went into a typical suburban pediatric practice with 5 other doctors. And it was fabulous. We had every tool available to us. We were right across the street from the Children's Hospital in Atlanta, Scottish Rite. It was a wonderful place to practice medicine with wonderful doctors, all capable, all smart, all who cared about their patients. And honestly, we all just got along beautifully. And because we all had the sort of same goal in mind, and that was to be good doctors for our patients and provide them the service they needed. Our practice was different than the way people practice medicine now, because we did everything. I went to all the high-risk deliveries, helped with all the babies after they were born. I admitted all my own patients, took care of them all in the hospital. None of that's done anymore by pediatricians. Either you're an inpatient doctor or an outpatient doctor. And honestly, when I left my training program, I felt very competent and confident in being able to do that kind of medicine, because my training program was very, very heavy on taking care of very sick children. What I lacked was knowing how to take care of well children. So I learned how to take care of well children because my patients taught me how to take care of well children, and my partners taught me how to take care of well children. So I was there for 13 years, from 1982 until 1995, and then transitioned out of there over to the Techwood Baptist Center. And I really experienced a significant call, I felt like, where the Holy Spirit really, really spoke to me about wanting to be involved in medical ministry at a place like the Techwood Baptist Center. But I'll back up just 1 minute. When I found out what Scott Morris was doing at the Church Health Center, it dawned on me that I needed to be doing that very same thing, being involved in some kind of a medical inner-city ministry in Atlanta. Before that time, it was the notion was ill-defined in my mind about what kind of medical missions I should do. But when I heard about him doing that, a high school classmate I knew, I can't say I knew him well in my school, but I knew him. I said, that's what I need to be doing. And then I set about how to find to do this. Where am I going to go? And then in 1995, actually it was the winter of '94, I came in contact with the Techwood Baptist Center and toured the place, not realizing when I set upon it to tour it that they even had a tiny little, pretty dilapidated medical clinic inside. And when I walked inside and saw the medical clinic, I'm honestly clueless they even had one. It was like God spoke to me and said, this is where I want you to be. So then, fast forward to August of '95, I started there and was there for almost 3.5 years before starting the Good Samaritan Health Center. And now that's what we're going to talk about. So back to the subject of succession planning and leadership transition, the founder's dilemma. I'd like to read for you 3 paragraphs out of a book I've just written. And the reason I want to read it is because I think it really captures, at least in my opinion, because I wrote it, it really captures the heart of, at least my heart anyway, of a typical founder. And this is in basically almost like the last chapter of the book. Founders, as I have learned, and I am no exception, loathe the idea of someone assuming their position of chief executive officer. The founder's mentality is that I conceived, gestated, birthed, all the doctors in the room will appreciate my words here. I conceived, gestated, birthed, nurtured, led, grew, and developed this organization. I have been here before there was a here. I have unstopped toilets, and this is the truth. I have unstopped toilets, you know. I've cared for patients. I've raised money, picked up trash, hired and terminated staff. Without a job description, basically I have done everything, both the pleasant and the unpleasant, in building this entity from an idea to a thriving not-for-profit, accomplishing great things in the world. The founder's posture is that no one knows this not-for-profit better than I do. I know our unabridged history, how we have failed and succeeded. I know who are our supporters and detractors. I am the guardian of all things related to our work. Now, I'm going to pause there for a minute and stop. You know, that's sort of a person thinking that, but honestly, God is really the guardian. But still, I'm sort of reflecting on this as a person, but God is the guardian of all things we do. So I'm the guardian of all things related to our work, and as such, I will do all I can to protect our vital mission. I reason that no one could run this organization as well as I can. This is my baby. Think about it. Founders, I've noticed, put their hearts and souls into their work. It is their lived and breathed journey, experiencing every moment, day in and day out, 24/7 without a break. The thought of turning in the keys and walking away is something that founders have a hard time wrapping their hearts and minds around. The reality is that that time will come, like it or not. So back to the subject of succession planning. You know, at the time, I was thinking about sort of turning this over to someone else. I realized that no matter what, I was still going to be 100% vested in what was best for us. So that never changed. But I did have, early on, and for most of our years, I still came from the perspective that I would be one of those founders who would never retire. That would be one of those never retiring founders. But being one of those never retiring founders begs the question, how did I consider beginning with end in mind, or stated another way, how was I able to come to terms with the notion of not being one of those never retiring founders? The simple answer is that both my head and my heart had to be convinced of the importance of leadership transition in a timely way. And sometimes I think the head being reasonable sometimes is more easier to convince the heart, which is the emotional part of things. And I think for me that was the way it was. Now for the head, now the first thing I put up there, no one lives forever. That's pretty much a duh statement, isn't it? So, but we still have to come to terms with that at some point. And I started having to come to terms with that, realizing that no matter what, you know, I'm not going to be able to go on with this forever. And right now, I'm still blessed to have very good health, and Lynn is very blessed to have very good health, but things can change. And you know, when you hit our age as being over 70, things can change in a moment. So still, you're not going to go on forever. Second thing is that you see there, it's better to have a plan in place than to manage a crisis. Think about this. What if I died? Then we'd be managing a crisis. Now, I heard a bit of a testimony about this from James Brooks on Thursday morning. He was talking a little bit about his experience in going from being an employee of Lawndale to being, to being a leader at Lawndale to the chief at Lawndale. But he said that as soon as they made him sort of the chief, the guy who was the chief left and walked out the door. And he felt like he was not mentored and prepared to take that job. That's a mini crisis in a way. So you want to try to avoid a crisis. So have a plan in place. And then the third thing to get my head around, so I didn't want to have a crisis. I'm not going to live forever. And it's better to have, and then I had to consider, and this was probably in some ways the most important thing, consider what is best for the organization's mission and long-term success. You know, and if I was truly interested in supporting the Good Samaritan Health Center's mission and leaving the Good Samaritan Health Center positioned for success and long-term sustainability, then I must subordinate my own personal needs and desires to that of the Good Samaritan Health Center. So once I was able to convince my head to jettison the never retiring notion, I needed to work on my heart. And honestly, like I said, this was the hardest part, because the idea of just handing in my keys and walking out the door one day was something that was just too heavy to me. I can remember, to sort of think back this, has there been a time in your life when you ever sort of done something like that? Yes, there was once. When I sort of turned in my keys and walked out the door at my private practice for 13 years, I felt an extreme amount of heaviness, because I loved what I did. I loved the kids I took care of. I loved my families. I felt like we were practicing good medicine there. We were doing everything right. And that night, Lynn and I, we went to La Grada to have dinner. And we took with us her sister and my sister-in-law and her husband. The four of us went to dinner that night. And there was only 3 happy people there. There weren't 4 happy people sitting around there. I was kind of, this is not good. But nevertheless, I knew what it was like to walk out the door and hand in the keys. And it was not an easy thing to do for me. So I had to convince my heart as well. And so I think it took 2 significant things to convince my heart. And the first one was, and probably in some ways the more important of the 2, is to have a very competent or capable leadership team in place. And it took us a long time, the Good Samaritan Health Center, to actually have that. This is our 28th year. And so you say, okay, well, you were kind of the boss for 26 of those years. Yes. I cannot say that for the first 20 few years of that was the case for me. It was only the last few years that I really felt that I really had capable, competent leadership in place. Because once you get to a point of having capable, confident leadership in place, you feel like, okay, I can let someone else do this. And the second thing is, and this is where turning in the keys, that I would simply not retire, rather I would transition to a new, supportive, subordinate role. So that's what happened with us, and I'm going to say sort of how I was able to do some of these things. So being in the new sort of subordinate role, like my main job right now is doing patients, but I still am very supportive of our leadership team. So now here comes sort of maybe some of the faxy stuff. So the how-to stuff, the less than fun stuff. So you can kind of get this down if you want, or if you want to wait and come back when it gets more fun again, we will. But nevertheless, this is how to successfully, this is the how of successful planning and leadership transition. So you have to consider the source of your new chief executive officer. And of course, the book will tell you if you do it, you have to go do a national search. Well, I knew that. I knew that's what the book would tell me to do. But I also knew what kind of I wanted in the long run, and that was I really wanted to hopefully find somebody who was internal. I wanted to do it that way. But I knew that wasn't always strictly the possibility, but I was hoping all along that would happen. And in God's timing, God's way, it did. So you have to consider the source. So you can get someone from within or someone from without that you recruit. And then you think about developing and mentoring your talent. If you're going to do someone inside, you think about developing and mentoring your talent both broadly and specifically. And you also think about how the process you might use in promoting your CEO. So developing and mentoring, you look around and you sort of say, who has leadership potential within our organization? Who possesses leadership qualities? Consider how I might give those people opportunities. How might I give them opportunities to grow within the organization? And how can I have an opportunity to personally mentor that person? So in sort of like observing your talent, watch them work. Watch your people work. See how they interact with you, how they interact with others. Give them additional responsibilities and opportunities to solve problems. And this is what I'm going to take a pause for a minute and say solve problems. You don't want someone who is a problem maker. You want someone who's a problem solver. And I learned that principle from someone who actually worked with me and for me. Laura Lane. She was saying, you know, if people want to come to me and talk to me about, I have this problem, this problem, this problem, she would turn it back around and says, come back to me when you have some suggestions for solutions. So you want somebody who's a problem solver, not a problem bringer. So allow the people you're considering to watch and work with other leaders, both yourself, other staff members, and the board. Allow them to see how you interact with other people, both the board, with other organizations, and through collaborations. Give them opportunities to work with outside organizations, partnerships, and collaborations. Give them opportunity to make presentations, whether it's presentations before the board or presentations before the staff. Give them opportunities for advancement, promote them within the organization. Allow them to attend conferences where they can develop leadership skills. And then one of the difficult ones is give them an opportunity to make tough decisions. And one of the first tough decisions I think that any of us have to do is let someone go. And you know, when you do that, we'll go through that process, you agonize over it, right? And I heard someone say to me at our little round table on Thursday morning, and I wish I'd heard this years and years ago, but she said something that's really, really good. She said she would be in her conversations with people that she was letting go would say, you know what, we're about to have a difficult conversation. That's a good way to start a conversation, because usually you kind of say, well, you know, I got some unpleasant words or something like this, blah, blah, blah. But nevertheless, give them opportunities to make tough things like terminate people, which many times is not pleasant at all. So I think it's also important to give the person opportunities to work directly with me and report to me, and to be able to share in the inner circle and solve problems together and offer advice. And then down here we saw about the process of evaluating and promoting the CEO. I think there are several things that I was doing in the process. One was observing, second was talking to key board members, and then also talking to the prospect. In observing, of course, I'm watching, or was watching, the person work with staff, work with me, work with the outside collaborations with outside organizations, and also considering while I'm observing is how the staff responds to the person. Do they embrace the person, love the person, respect the person, those kind of things. And then I've talked to key board members. And we have a board of like 18 people or so, but it's fluctuated between maybe 12 or 13 and 21 or 22 or something like that. But you also, you know, in a situation like that, you still have key board members. You have that inner circle of board who you might consider your executive committee. And so 5, 6, 7 people that you've grown to love and know and respect. And I've been blessed by having a really great board. And honestly, we have suffered no big conflicts. And Brianna's here to give testimony to that fact. One of my board members is one of my brothers, and he has been a board member since day one. So he's kind of in that inner circle. Then there are a few others. So I would talk to them when it came time to promote her to be our CEO. I sat down and say, you know, I'm gonna step down out of this job. I want y'all to know that. That was their first time they sort of heard that. And I would like for you all to consider her. And so we sat around and talked about it. So it's observe your person, talk to the board about it, then I think also talk to your person that you're trying to promote. And so some of the kind of questions you know, that I believe I proposed to Brianna and to some of the others is like, what are your personal goals here at Good Sam? What do you see your long-term career being and things like that? And then, you know, do you vision your future being permanent here or temporary? These kinds of things. And do you have any thoughts about my future? Then after kind of going through some of this, and it came back to the fact that then I would say something like later on about, well, I'd like for you to take my job one day. And so we had that conversation, take my job one day. So these kind of things I think are very important in the how-to. So this is maybe the hard part, and it may be the hard part for some of you who are thinking about transitioning out, not retiring. But if you have retired, of course, or excuse me, if you are going to retire, hand in your keys and walk out the door, then congratulations, job well done. And let's go, we'll get to that at the end here, back to my question. But if you're thinking about transitioning, of course, this creates a new dynamic, doesn't it? Because I'm here and the new CEO is here. So how do you handle this? I think that I considered several things in trying to handle this. And I think part of the deal is that it had to be that the new CEO had to be more comfortable with it than I had to be comfortable with it. I will say that. But also when we had our conversation, when I say Brianna and I had our conversation about her taking this role, I also said that I don't want to leave. So it's kind of like put to her that way. So how would she respond to that? Well, then I can't take the role. No, I can take the role with your being here. So that was sort of part of the conversation we had. So the new CEO has to be comfortable with my presence. And I think the new CEO has to be a very strong, confident person. Because you have to be, when you succeed someone who is still there, you still have to be strong and confident in yourself. So very competent and confident and very strong and capable and comfortable with my presence. And I think the old CEO, me, must have a dose of humility. Now, we said this on Thursday morning, our little breakout thing with the Executive Summit, that it does take a dose of humility, but as soon as you stand up and say, I'm a humble person, you're not anymore, right? So I'm not going to stand up here and say that I am a humble person, but still it takes a little bit of humility to be able to subordinate yourself to someone when you were the boss one time and now you're not anymore. I have to have a willingness to let things go. You know, a lot of times you see little small things, say, oh, I wish we'd do this, but let it go, let it go. Do not get into her business and her decision making. That's her business, her decisions, support it, right? Don't question her decisions, support them. Here's a really big one, I think. Do not talk about her behind her back. That undermines her authority. Do not talk about her behind her back. And then Brianna mentioned something on our Thursday morning session about that I asked for a job description. I think it's important to have a job description. I asked for one. And so she and I wrote that together. And of course, the number one thing is be a pediatrician, okay? So I am. Another one that I wrote in my job description that she didn't put down there was, I've just finished writing our book. And it's at the editor right now, ready to be published. And I'm anxious. I'm ready for the process to move along, right? So those kind of things. So my main job is to be a pediatrician and also stand in support of what she is doing. I'm going to stop for 1 minute there and say, before I transitioned out, our leadership team were 3 of us, herself and one other woman on our staff who has been with us, 5 years now? Yeah, 4 years? Okay. They reported to me, and we sat around every 2 weeks for an hour and talked about things. They reported to me actually then, and so I would ask questions. They would tell me about what's going on. If they had a question about something we need to solve, we would kind of go over it and try to come to some conclusions. Well, I think it was a real blessing to me when part of my job description is still be available to them. So we still meet every 2 weeks, but roles have been reversed. I try to come with notes to make a report. I try to. This is what I'm doing. This is what I've seen, blah, blah, blah. But sometimes they do ask questions and say, has this ever happened to you before? Because I'll give you one so small example. We're in the middle of a big building project, both a renovation on part of our main building and we're building a 3rd building on the campus. Well, we had some unpleasant experience with the builder, so we had to terminate the builder. That unpleasant experience with the builder turned into an even more unpleasant experience. He sued us. And so the question, yeah, so is that a good thing?
Technically avoided a lawsuit.
Yeah, excuse me. We avoided a lawsuit, but there was a threat of a lawsuit. The threat of a lawsuit. And so the question was, when I sort of our little huddle there, have you ever been through something like this? I said, egads, no. The closest thing we ever been to is we had the builder we had previous to that built our second building was kind of an unpleasant experience, but they did build the building right. But still, it was an unpleasant experience that finally one of our board chairs sort of had to get involved with and manage it to a large degree. So I had a job description, and I think the last thing that as a CEO, a former CEO, I must, is I have to bring some value to the organization. You can't just be here. You can't just come and use your key fob and come through the locked door and sit down and have coffee and hang out. I had to bring some value. So I think being the pediatrician is probably the biggest value I bring, but also having history, I think, is another value I bring, and being able to sit around with the two leaders I had, and if they have questions, to ask me questions, things like that. So there's some other things I think I bring value, but I clearly believe you have to bring value if you transition out. Because I've seen it happen where people hang on and they just don't bring any value anymore. And so the third thing down there, together we must define boundaries. You know, what are the boundaries? And have a clear understanding of roles. So we define boundaries and have a clear understanding of roles. Now, here comes the dirty part. What happens if boundaries are violated? Well, I think the first thing you do, and it's biblical, is you have a conversation. That's what it says. If your brother has offended you, go to talk to your brother. Jesus says that. If that doesn't work out, it says call 2 or 3 people together. So in our case, it'd be call the board. So the second thing you do is get your board chair involved. So there are 3 people talking at that point, and then go from there. And then I think that's only 2 things I have down, because I think the last thing happens if if you reach an impasse, then I'm the person that needs to go, you know, that kind of thing. So anyway, that's sort of the how-to. So we come back to the question, who would you rather align the trajectory of your career with, Bjorn Borg or Tiger Woods? Now, does anybody have any idea where this is going? So probably, y'all are all so young, you probably didn't even know Bjorn Borg. Well, you knew him. But Tiger Woods, you know him well. Okay, now after I give a little summary of each of their careers, you'll figure this out. Bjorn Borg retired at age 26 in 1981. He was at the top of his game. I'm told 10 minutes, so good. He was at the top of his game. He was ranked #1 in the world in 1981. He had already won, by that time, he had won 11 majors, the last of which was the French Open in June of 1981. And he was runner-up at the US Open later that September. I think John McEnroe was the one that beat him there. So he was ranked #1 in the world in 1981, the year he retired. He retired a champion. On the other hand, Tiger Woods, who won 15 majors, the last one being the Masters in 2019, 7 years ago. He was last ranked #1 in 2014, 12 years ago. He is not currently ranked #1 in the world. He is ranked 2,590th. 2,590th. He is not retired. And you know, you think about him, he's sort of a pitiful version of his former self. He's had a lot of personal problems too, as we all know. I mean, he even had a bad car accident like a week and a half or 2 weeks ago. Just another example of kind of like a life gone off the rails a little bit. So sort of my charge is for each of us not to be that kind of a retiring chief executive officer. Be like Bjorn Borg. Leave your organization well positioned for success and sustainability. And with that, I'm very happy to answer questions, so thank you.